Hello, friends and family. I am joining you today to share the next steps of the tribe's response to the COVID-19 pandemic. The last time I addressed you like this was just before the arrival of the COVID-19 vaccine. I was fortunate enough to be among the first in our tribe to receive it. My experience was documented in a video that included Dr. Lindquist talking about the new normal the vaccine would usher in. He was clear that even with the protections the vaccine provided, COVID-19 wouldn't suddenly disappear. We would have to find ways to live with it while doing everything within our power to protect our community. Immediately, though, the vaccine was our best way through the worst of the pandemic. With it, we can end lockdowns and gather once again with family and friends. Many of you took this message to heart and lined up to get vaccinated. Today, a majority of our community members and an astonishing 86% of our tribal government staff are fully vaccinated. This is a massive success, and we should all be proud of how far we've come. Now, we find ourselves in a new phase of the pandemic, specifically the new normal Dr. Lindquist talked about. Health professionals, including our own Dr. Lindquist and Dr. McDaniel, are clear that the vaccine is safe and effective, especially at preventing the worst outcomes associated with COVID-19. But no vaccine is 100% effective. There's always a chance that a vaccinated person will become sick with the virus. These are known as breakthrough cases, and earlier this summer, I became one of them. I tested positive for COVID-19 in July. Thankfully, my symptoms were mild. Unpleasant, certainly, but not life-threatening. My wife, who is also fully vaccinated, did not become sick. I attribute the vaccine to her staying well and my experience of not being much worse than suffering through a bad head cold. Across the country, as mask mandates have been lifted, there has been a summer surge of COVID cases, especially among the unvaccinated. Some of these individuals are becoming seriously ill or dying. The reality is, COVID is still here, and we must continue to manage it. The science is clear on a path forward. The combination of masking, testing, and vaccines. To this end, we have re-implemented a mask requirement everywhere on tribal campus. We are also strongly encouraging mask wearing to everyone while in public. As of last week, we reinstituted staff testing. All employees, no matter their vaccination status, are being tested for COVID-19 weekly. This will continue at least through the end of October. Today, Tribal Council approved adding COVID-19 as a mandated vaccine to our required immunizations for staff. The mandate will apply to all tribal government, business, and foundation employees who must show proof of full vaccination by November 1, 2021. Given the ongoing nature of this pandemic, we are taking this step to continue to ensure our community and workforce remains strong and healthy. I understand that some people remain unvaccinated because of safety concerns, or maybe they worry that the vaccine will make them sick. Perhaps they hear stories of breakthrough cases like mine and question the need to get vaccinated at all. To the unvaccinated, I want to say, your concerns are valid. You also owe it to yourself to discuss them with people who understand the science. Please, contact our community health center and talk to their staff. They will answer any questions you might have without judgment. Please trust our professionals. They haven't let us down throughout this pandemic. We are in a new phase of this pandemic, but still in a pandemic all the same. Navigating this new normal means utilizing the tools we know work to continue to achieve our highest priority: protecting the tribal community from this deadly disease. I thank everyone who is doing their part. Hot and still.